Hello, and welcome to the second installment of the Ehlers-Danlos Society's Living with EDS and HSD webinar series. Thank you all so much for joining us. Today's topic is movement therapy as a cornerstone of EDS well-being with Jeannie Di Bon. My name is Jessica Adelman, and I'm the Social Media and Communications Manager for the Ehlers-Danlos Society, and I'll be moderating this webinar today. I have a quick note on how this will work. Attendees are in listen-only mode at all times and will not be able to verbally ask questions. However, you can type questions at any time in the question box on your screen. These questions will be addressed during the question and answer time after the presentation. We ask that you please only submit each question that you have one time. Thank you for your understanding and cooperation. Without further ado, I'd like to introduce Jeannie Di Bon. Jeannie Di Bon is a movement therapist and rehabilitation teacher, author of the book Pilates Without Tears, and founder of the London-based studio Create Pilates. She has been teaching Pilates since 2008 and has trained with internationally renowned organizations Polestar Pilates and Body Control Pilates, and she is a certified member of the Pilates Method Alliance. Jeannie's areas of expertise are rehabilitation from injury and illness, chronic pain management, and hypermobility syndrome and EDS. Being hypermobile herself, she was drawn to the field and now has a large client base with hypermobility and EDS. Through working on her own body and with her clients, she has devised a structured Pilates-based program called Strengthen Your Hypermobile Core. So I'm going to turn it over to Jeannie now. Thank you so much for being here.
Great. Hello. Hi, hello, this is Jeannie, and thank you, Jessica, for the introduction. Good morning and good afternoon to wherever you might be listening from. I hope you can hear me okay. So I'm going to make a start on our presentation this afternoon, movement therapy as a cornerstone for EDS wellbeing. And if you can't hear me at any time, just type me a message and I will try and get that sorted out. So let's get started. So a couple of things I just wanted to talk about before we got into the detail. I think it's really essential that we recognize that movement therapy is unique to the individual. So all of our symptoms, all of us will be experiencing physical and emotional and psychological symptoms totally differently. Everyone will have different pain thresholds. There's no two people who are listening who are going to be experiencing exactly the same things. So that's really important, and that underpins my theory and my method. Physical symptoms, as it says there, these are just a few. Obviously, we know there are many more symptoms, but these are some of the physical symptoms that we might be experiencing and things that Pilates and movement therapy can help us address. And then emotionally and psychological support, so anxiety, tension, stress, all of those things I found through my body and also with that of my clients are also a really big issue and feature of EDS and hypermobility. So my integral movement method is Pilates based, and we'll be talking a little bit about Pilates, but it does have a 360-degree perspective to movement. So by that I mean I try and encompass the physical, emotional and psychological aspects of movement. So it is movement therapy as opposed to just a Pilates based program. Okay, so for those of you who don't know me, just and thank you, Jessica, for the introduction, but just a little bit of information. I have been teaching Pilates and movement therapy since 2008, and as Jessica said, I have a clinic in London, and as it was already been said, I have a book, and my focus is very much on pain management, injury, hypermobility, and EDS. Okay, and I like this photo. It always makes me laugh because this is a photo of me when I just qualified to teach Pilates. But as you can see, I've still got those hyperextending elbows. So I still had a lot to learn back in 2008 about my own body. Okay, so as I said, my background is Pilates. I trained in 2007 in the Pilates method. So I just wanted to talk a little bit about Mr. Joseph Pilates. I know that some of you will already be practicing Pilates, but some of you might not know anything about Pilates. This photo here is of Mr. Pilates. Now, I don't recommend anyone goes home and tries to do what he's doing, but He was quite a unique character, and here he is standing on someone's abdominal muscles just to prove that his method gave you strong abdominal muscles. But please don't try that one at home. Okay, that's something that he used to do. But he wrote a book called Return to Life, and a couple of quotes in his book really resonated with me when I was reading it during my training. One of them was, the Pilates method teaches you to be in control of your body and not at its mercy. Now, I don't know about you, but that really resonated with me, because when you have hypermobility and EDS, sometimes you feel that you're not in control, that your body does whatever it wants, and there was no way to stop this happening. And I read this and I was like, it was really intrigued me. And one of his other quotes is, change happens through movement and movement heals. And again, I've certainly found that movement heals. And with working with people, we've had really positive results. And I hope to demonstrate to you today how movement can be, as I say, a cornerstone of your therapy. It's not a replacement, but it really fits into this whole holistic package of different types of therapy that you might be going through at the moment. So if we move on, just talking a little bit about Pilates. As I said, some of you may already be doing Pilates, which is great. Some of you might not know much about it. There's a lovely photograph here, and as it says at the bottom, not every exercise is going to be suitable or necessary for everyone. So if you look at that photo, obviously she's clearly a very hypermobile lady. She's probably a dancer or a gymnast. Probably not the best sort of exercise for most of us. And as I say, it's not only wouldn't be suitable for many of us, is it necessary? And that's one thing I really question in my teaching. And it's, why are we doing an exercise? So unless I'm a dancer, unless I'm a gymnast, or I work for Cirque du Soleil or some kind of performing arts, or I'm a sports person, maybe I play tennis, I need big range of movements. Is it really necessary for me to be doing an exercise such as this? And a lot of the time it's no. So it's about what's appropriate for us. So the title of this slide is what's right for my body. And as we said at the beginning, everyone is unique. So there isn't a one size fits all. In most cases, we are all unique, and all of us are going to experience things differently. So on the right hand side here, it says the different sorts of Pilates that you might have heard of. There's mat Pilates, contemporary, classical, clinical, which is normally taught by a physio. There's reformer Pilates, which is what this lady is exercising on. And then you've got things like high intensity Pilates, cardio Pilates. There's so many different types of Pilates. You can learn it in a group. Some of you might go to group class. You can have it as a 1-to-1 or a 2-to-1. Now, as I say, my training was in Pilates, and I am forever grateful for coming across Pilates. It was a physio who introduced me to Pilates because I was in so much pain and I had zero awareness of my body, and I was literally hanging off my joints. I was in constant pain. So thankfully I met a physio who said, go and try some Pilates, which I did, and that's what set me on this journey. I absolutely love the Pilates method. But as I say here, there are different schools of thought. There are so many different types of teaching schools out there. There are different degrees of teaching. Some people can do weekend courses. Some people will invest years and years in their training. So you really have to, if you're thinking about Pilates, you do have to do your homework first. You know, ask questions, find out how much the studio or the teacher knows about EDS. You know, don't be afraid to ask questions. And if they don't know about EDS at the beginning, that, you know, that's fine, because so many people don't know about EDS, but are they willing to learn? Are they willing to adapt exercises for you so that you could take part in a Pilates class? It's not obviously a replacement for any physical therapy or medical treatment you're having, and always consult with your medical practitioner if you are starting a new exercise. So as I said, I trained in this method, and I loved the method. I loved the control. I loved so many aspects of it. But at the same time, I started to have some questions about it. So not long after I started teaching, I decided to look beyond the repertoire of Pilates. So I started to have many questions. And I became much more curious about things like, why are we doing things in a certain way? Why does the body do these things? Why am I being taught only about my core and my pelvic floor a lot of the time? You know, a lot of times we're told to brace and to draw in the abdominal muscles and fix our muscles. And there was all this language going around that I was hearing that didn't really make sense. And it certainly wasn't ideal for my body. So I began this search for knowledge, and I wanted to know more beyond what I was being taught as an exercise, as a method of Pilates exercise. So I studied anatomy. I went to dissection courses. I wanted to see what was under our skin. I wanted to see what the body was really like inside. I discovered all about the fascia, the connective tissue that is collagen based, so a huge impact on us. What impact does fascia have on our movement? I looked at biomechanics, I looked at yoga and somatic movement practices. So I looked at so many different things, and I realized that the language that we use to each other is going to impact the movement that we actually make. And so if you think about it, the language is going to create thoughts in your body, which then creates feelings. Now those feelings are going to help impact the movement that we make. So if we're presenting with connotations of force, like being told to squeeze or fix or pull or brace, for me, certainly it was causing a lot of stress and strain in my body and putting tension in my body. So I call them tension-led patterns. And it certainly felt as though it was blocking the connection between my mind and body a lot of the time. And that's what really led me to this idea of a no pain and no strain evolution, as opposed to what you often hear in gyms and etc. is the no pain, no gain. So my method was very much about a no pain and no strain approach. So a softness to the approach. So the Pilates method, you know, is absolutely, Joseph Pilates was a genius. He created these machines for us to work on, all out of his own ideas, which I think is just amazing. But I questioned certain things about that method, about the method, and I just wanted to make it a little bit more adaptable for myself and then subsequently for my EDS clients. And I just wanted to try a different approach. So that's kind of what led us to the integral movement method. And I want to give some credit to some of the people and the books that I read that helped me on that journey. So, you know, if you came to my house, you'd probably laugh because I have so many books, hundreds and hundreds of books. I could probably open a bookstore now of all these different types of movement methods. And I attended so many courses to really, I was so desperate to understand the workings of the body. One of the ladies is actually a yoga teacher. She's no longer with us, Vanda Scaravelli, and I mentioned her in my book. And she said some beautiful things that I thought really resonated with me and my clients. So she used to say that it's not about the performance of the exercise that matters, but how we approach them physically and mentally, which I think is really important, because sometimes I feel as though we're taught an exercise, and this exercise has to be done perfectly. And you have to follow it to a strict rule, and you have to breathe in a certain way. And if it's not done like that, then it's not the Pilates method. And I didn't like that rigidity for my body. And so the way she was approaching movement was really, really beautiful. And she talks about the mind and the body being so connected that we can't tell the difference between them. So she was a big influence on my method. And then I also looked at people like Mabel Todd. She was another somatic educator. And this was interesting. She would say things like, every thought supported by a feeling, there is a muscle change. So how powerful could that be for us as EDS community to actually think that if we have the right feelings, we can make changes? And being aware of our own body, you know, sometimes, as we know, proprioception, lack of awareness is a huge deal for us. But being aware of our weight and our motion is actually going to come from within us. So how can we create those feelings within us? And I think all of these elements, plus there are so many books I've read, but these are two that I particularly like. these things really helped. I kind of brought them into the Pilates method and molded it. I often say if I had a method, it would probably be Scaravelli inspired Pilates, because I brought all of those things together into one method. So things that I tend to hear from new clients, and these are just some of them, and you might resonate with some of these things, that pain is a part of life, I manage, it's normal, I'm scared. So many things I hear, and you know, it's sad to hear, obviously, and we've all been there, we've all been in pain and feel that, you know, we're too tired to do exercise. So these are things that I hear from my clients. But this is what I believe. I'm a huge believer in small steps, and I firmly believe that everything we do counts. We're looking for progress, not perfection. Okay, so remember, it's not how we perform the exercise that matters, but that feeling, that mind and body connection, our approach that matters. So it's not about performance. I often say to my clients, I don't care what it looks like. I just want you to move and enjoy it and have awareness. So I'm not looking for this perfect execution, because all of us would probably do an exercise totally differently anyway. Emotionally, making a very small step, you might say, well, actually, I can't do this and I can't do that, and that's absolutely fine. But if we could adapt that and make it a really something that was meaningful to you, that's a massive emotional step, and that is so crucial for our overall well-being. So it's all about self-awareness and self-belief, and through those things we're going to get confidence about moving, confidence about our daily life, and we're going to get more resilience. So if there's one thing we really need is resilience. It's one thing that I gathered from Pilates and movement therapy, is to be more resilient mentally and physically. And I believe that pacing is essential. We hear a lot about pacing. You know, some days we feel good and we go off and we do hundreds of things, and the next day we pay for it because we hurt and we're tired. So built in to my method is really looking after that unique person, not trying to package the person into an exercise, but let's adapt the exercise to the individual. So that's really why I call my method a movement therapy, as opposed to, you know, an exercise, Pilates or yoga or something like that. And we've heard, of course, there's so much research out there that exercise is good for the body and the mind. And I know that's hard because some days we just don't feel like exercising. But if we could package that up into small steps, we are going to feel better physically and mentally. And as I said, it's the approach that is key to the exercise. So, you know, in my 20s, I did yoga probably for the whole of my 20s until the birth of my first son. And I was in agony all the time. So I used to go to class 3 times a week, and I'd be in absolute agony afterwards. Not once did I question the fact of my approach to the yoga. I think I only ever thought that it was my fault and that my body wasn't good enough and wasn't strong enough. And therefore, if I pushed harder and tried harder, then my pain would go away. So I didn't once, because I had so little self-awareness back then, I didn't once question my approach. Now, does this mean that yoga is bad? Absolutely not. You know, a lot of people say if we've got EDS, we shouldn't do yoga. Yoga is bad for you. I disagree. I don't think yoga as itself is bad for you, but our approach to yoga is probably what we need to look at. So now, I sometimes go to a yoga class. I can do a yoga class without hurting myself because I have a new approach. So I'm not ruling out any exercise. It's, you know, we have to find something that is right for you and what you enjoy, because if you enjoy it, you're going to stick at it. But it's really the mental and the physical approach and the use of the language that is going to make that more enjoyable and more sustainable for us. So small steps, really important. Okay. So at this stage, I like to introduce 2 of my clients to you, because I think it's always nice to hear from real people. And so I'm just going to, these 2 ladies very kindly took part in an interview for me, which I've used as case studies. And I just wanted to share some of those details with you. with their permission. So my first lady, this was how she was when I met her. She came to me, she'd been pushing her body very hard. She used to do things like triathlons, and she was very hardcore. She liked exercise. She'd always been bendy as a child and doing the funny tricks. But she started in her 30s to experience these dislocations, subluxing, after pushing herself with exercise. Back pain every day. She just thought that was normal. And she would take her anti-inflammatory medication and just accepted that pain was now part of her life. So this is how Sarah was when I met her. And just out of interest, this machine here, this is me, and this is me teaching a client on the reformer machine, which is one of the machines that Joseph Pilates created. Perfect for rehabilitation because it has spring resistance that is going to give you lots more feedback for your body, which is one thing that we require. So that's Sarah. And then I have another lady called Emma, who was a young mum when I met her with 2 small children. And she had been in pain since sort of around the year 2000, very, very injury prone, always subluxing. I mean, the slightest thing she would sublux, uncoordinated, which we know is a feature, that lack of proprioception, shoulder pain, sciatica. And of course, with all of these things going on, she was a busy mum. She was obviously stressed and quite low. And she had been misdiagnosed as well at the time. So how were they after we'd done some work in the studio? So this is Sarah, and I'm going to read an extract to you from her interview, which again will be in her own words. Here I've just sort of paraphrased what she said. So Pilates completely changed her physical life. She's relearned how to move totally, and she exercises pain-free now. She no longer lives in constant pain, and importantly, she sleeps throughout the night without the pain waking her up. So she hasn't taken any painkillers. It'll be 4 years now since we had our interview, so 4 years. And why does she still do her movement therapy? It keeps her fit, keeps her joints healthy, increases her endurance, and tones her body. So if we just hear from Sarah, I'm just going to read a little extract to you. She said, it was a physical epiphany. I actually cried when I realized that I didn't need to live in constant pain. I've retaught how to stand, sleep, and walk. I've had to relearn how to move. My husband says I do not walk or move like the woman he married. I now exercise pain-free, and I have not taken any painkillers for joint pain for well over 3 years. I wake up without pain, and I'm not disturbed by pain in the night. So that's really, really positive and really exciting for Sarah. And here, just this photograph, this is me again, doing an exercise here on the reformer. And these photographs that you see, they're normally of me. These are all exercises that, if appropriate, I would certainly have over time an EDS client doing as well. So none of these things are, if suitable, obviously to the individual, are out of reach. Okay. So if we look at Emma, who is the young mum with 2 small children, she still comes to her classes every week, has less physio now. She's certainly less injury prone. She has minimal pain, but she now knows what triggers it and how to avoid it. She uses her breathing. We'll talk about breathing in a little while, but she knows the power of breathing now to help her relax. She has greater body awareness and feels totally transformed. So let's just hear from Sarah. Just one second. From Emma. So Emma says, the control and awareness it has brought to a hypermobile person that has had a bad perception of things is invaluable. I can now exercise safely within a range and with control, something I'm now totally aware of, knowing when to do an exercise and what I'm capable of. Also, because of the connection to my body, I feel a deep sense of movement and power from within. Do you remember what we heard from before, how we have to learn to feel from within? And here she is, she's saying she feels from within that she never had before. And interestingly, she also says, I feel more flexible and healthy. So although she was hypermobile, obviously in some places she was incredibly stiff. So she's actually increased her flexibility, but safely. So that's an interesting comment from her. Again, here's a reformer, me on doing a plank on the reformer. Again, requiring a great deal of organization of the body against resistance. But again, Emma does these every week. It's not something now that she would avoid to do. So as I say, they're all with the right approach, perfectly achievable. So those are two ladies that have been coming to me. And so how can we talk about this program for us as an EDS patient or client? So I've highlighted the fact that it's called movement method because it is movement. I see it as not going to an exercise class every week and then forgetting about it and just seeing it as an exercise class. It's an adaptable base for exercise or sport or for everyday living. So making this stuff real. So it's not about doing an hour's class a week. It's how can I make this movement part of my life? So when I need to pick up the children, or I need to do my shopping, or I need to change the sheets on my bed, all those things we need to do, how can I do those without subluxing my shoulders, or bending down and subluxing my knee, or my things like that. So that's really at the heart of it. I want to make this real. I want to make this functional for people. So it is Pilates based because that's where I've come from, but it's evolved through working with my EDS clients, very much a rehabilitation pain management basis. It's a 360-degree approach. As I say, we look at the mind and the body, the emotional, the physical, the psychological, and it's not about performance. It's not mechanical at all. It's not about getting it exactly right. We work on the mind and then the body, and we'll talk about how. And it really teaches us to build some solid foundations for our movement practice. And I'm going to run through these 6 integrated elements with you now that kind of make up the program and the method. But once you've got these, as I say, it just comes into your everyday being. So let's get started. So breathing. So this is me in my studio learning how to breathe. So that seems like a really silly thing to relearn to breathe, because we're like, well, of course I know how to breathe, because otherwise I wouldn't be here now. I'm breathing right now. But we do need to relearn how to breathe, because so many times we get into these faulty breathing patterns, which then cause tension in the body. And we're totally unaware of it because we probably breathe thousands and thousands and thousands of times a day. We don't even notice it unless we're having the palpitations or the panic attacks and things like that. So we're not really conscious of our breathing on a daily basis. So learning to breathe with a soft approach helps build awareness. So that's the first stage. I need to build awareness in someone's body, and that is then going to have a physiological impact on everything else. So it's going to start to evoke the rest response in the body, the relaxation response in the body, because when we've been in pain, or we've been stressed, or we've been fearful of movement, a lot of us are fearful of movement because we think it's going to hurt, or we are going to sublux. So how can we start to remove that fear? And the first thing is to literally just step back and take some time and learn to breathe. So we breathe first, and the movement is secondary to that, and it becomes a part of the movement. So the breath creates the movement. I'm not into teaching when to inhale, when to exhale, and making it about this mechanical breathing exercise. To me, that just causes more tension in the body, because people get so fixated on, well, when should I inhale? When should I exhale? Let's just let that breath flow in a normal way. And even with breathing practice, if you did nothing else, even becoming aware of your breath is going to help start to improve your proprioception, that is your awareness of your body, and it can reduce pain, because breathing can help relax the muscles. So if you did nothing else, but we just learned to do some breathing practice, that's an amazing first step. So breathing would always be the first step. When someone comes into my studio, I'm basically watching them breathe and seeing where the blockages are, because sometimes breath gets stuck in the body, and if it's stuck in the body, we want to get it moving again. So that's the first step. Relaxation. So as it is integrated into your breath. So I want to relax those tense muscles first. I don't want to collapse and hang off my joints as I used to do. That wasn't relaxing at all. That was painful. But we do need to release tension. So when we've been fearful of movement and afraid and in pain, tension builds up in the body. It's a natural response, and it's nothing we should feel bad about, but we do want to get rid of it. We will start to recognize when we start to notice the breath, we'll start to notice that we do have these holding patterns. So maybe you hold yourself in a certain way to protect yourself. And again, that's a perfectly normal response. But those responses hold us back. So they stop us moving. They make our movement rigid and less fluid. So we'd like to recognize those patterns and change them. Can we change your movement patterns to more efficient ones? Relaxation is going to give you fascial release. So we talked a little bit earlier about the fascia, and the fascia is the connective tissue that envelops every single organ in your body and every single muscle and every single bone in your body. It is full body, head to toe, no gaps, and it's very fluid, and it's made of collagen. So from our perspective, that fascia is a big deal, because it's, you know, if we've got a faulty collagen, then obviously our fascia is going to be affected. Now, the thing with fascia is it's the biggest sensory organ in the body. Now, if we can tune into that and become more aware of that releasing and being aware of our fascia and its sensitivity, we're going to improve our sensory awareness as well. So when we're in pain, the fascia is the thing that becomes very sensitive and often causes the pain. Okay, so fascia is a really big deal for us. As I say, it builds our sensory awareness, and it also promotes good sleep hygiene. So for many of us, sleeping is a big deal, mainly because obviously pain wakes us up. Good quality sleep is difficult, but with some relaxation practices, hopefully our sleep will improve as well. Okay, so we go through breath first. That then promotes relaxation already in the body. And as you can see in this photo, I'm kind of doing a very gentle rolling pattern. I'm just rolling my hips from side to side. Again, rolling patterns, very natural. It's what we did as children. They're very calming to the nervous system. So we often start with very simple, basic movements. Okay, so the big one, our proprioception. Challenging for us. Yeah, this is why we lock our joints. We don't know how far our range is. We end up getting ourselves in trouble because we go too far and then we hurt. So proprioception, can we build that? So yes, with my breath and with my relaxation, I'm going to be much more tuned in to my proprioception. So we can use things like bands, obviously reformers and things help build that proprioception. But awareness and control obviously are big deals for us, but we want to think of it as exploring. So can we explore movement? As I say, it's not about performing an exercise, it's about safely exploring ranges of movement. And I always say to my clients, it's not about the range, because obviously I know that most of them can do these amazing ranges of movement, but that's not why we're here. We need to, I actually rein them in. So I bring down their range of movement so they start to get some control. And generally they absolutely hate it because they, you know, we prefer to go wide and have these big stretches. But having big stretches all the time is not going to bring me any kind of joint control. So we rein it in, we keep it small. Gradually, we could increase the range again, but only when we've got that sense of awareness. So like I said earlier, I could go to a yoga class now, because I am body aware. So I know when I'm doing too much and I can rein myself in. So yoga is a safe option for me now, whereas it probably wasn't, you know, 20 years ago. So when you've got that proprioception, because you're more aware of your range of movements and know how to control them, you're going to have less pain. Okay, so it's going too far that often brings on our pain and overstretches that connective tissue. So once we've got these fundamentals, we start to kind of joint stability is the next logical step, because I've got my breathing, I've got some awareness, I'm starting to get some control around my movement. So now we can start adding in more challenging exercises. So as you can see in this photograph, I've now no longer lying on my back, I'm actually on all fours, which is a more challenging position. I'm weight bearing, so I've got to have some awareness of what my shoulders are doing and my elbows and my wrists. I've got less support from the ground, so it's more challenging anyway. And how can I comfortably move in this range of movement? And if you could just notice my abdominal area, so if you see my belly, it's quite rounded, so my belly muscles are quite relaxed. So there's no sucking in or pulling in of my abdominal muscles here. I am breathing, I'm fully aware of my breath, but I'm not doing any kind of squeezing, bracing, pulling. I'm just moving, okay? And I'm getting my stability from the ground and my own sense of awareness. I'm not having to brace to get that stability. Bracing is a false sense of stability that causes tension in the body, and it's not something I would ever choose to do, and I wouldn't get my clients to do either. So joint stability, we need a degree of awareness, but we start to have this core control. We have some protection now because we understand how to move. And once we've got that, as I say, bracing and fixing and pulling in and all squeezing, all of those things inhibit fluid movements. Okay, so we start to move more mechanically when we start doing all of that, rather than enjoying natural fluid movements. And that's what we want. And then we've got this no pain, no strain approach to movement. And you may be wondering why there's a photograph of my foot at the bottom of the slide. As it says there, I start at the ground and I work up. So anyone who's ever worked with me will confirm that they often say, why are we looking at my feet? What are we doing with my feet? So early on in any sort of lesson with me, we're going to look at your feet. You know, we said at the beginning, flat feet, collapsed arches, subluxing, always twisting our ankles, always, yeah, all of that I need to get remedied first before I even start looking further up the body. Because your feet are what you need to walk about on, your feet are what you need to stand on. If they're not stable, think of those as the foundations of a big, strong building. Imagine building a house on sand. You might start layering up your different things, but your house is soon going to start sinking and maybe cracking and collapsing. A bit like our bodies when we allow our feet to collapse and roll in. Not only am I putting my feet in trouble, I'm going to could start having knee pain, hip pain, back pain, even shoulder and neck pain. All because my feet are not functioning, they're not strong, they're not stable to hold me up. So the feet are always a big deal for me, and I like to get people, they always go home with foot exercises to do because it's a really big deal. So there's an example of a small step. You know, maybe you can't go and do an hour's exercise class of your choice at the moment, but maybe you could start doing some very, very simple foot exercises. And I can certainly share with you any kind of exercises that you'd be interested to hear about. And actually, I did do a blog on the EDS Society website a couple of weeks ago all about the feet. So that's a good place to look for some information about the feet. So that's our joint stability. Okay, balance. So we're getting to number 5 now. Again, you can see in the photograph, I'm now standing. So I'm standing on one leg. So that's pretty challenging. So often we start by holding on to something. So if you are very wobbly and we've got those ankles that could be a bit unstable, please hold on to something. You don't have to do these kind of things without holding on. But obviously balance is essential. So with lack of proprioceptions, our balance is often compromised. But I need to move about every day. So if I don't have good balance, I'm going to feel really vulnerable moving about every day. So when I feel vulnerable, my brain's going to go, uh-oh, be careful, there's danger. It will start sending messages down my spinal cord telling me to be guarding, to be, you know, don't move because it's unsafe. All of these things are going on in your subconscious. But if I've established good foundations, balance is going to not be an issue for me for much longer. I'm going to integrate that into my life. I'm going to feel stable. I'm going to feel strong. And because I've already done the pre-work, I've got strong integrated feet. So by that, I mean my feet are talking to my legs, which are talking to my pelvis, which are supporting my spine, which is supporting my head, neck, shoulders. So the whole thing, this fascia that we were talking about, this connective tissue, it communicates up the whole body. Yeah, so if my feet are happy, it's going to communicate up the body and everything's going to be happy and supported. So balance is part of the program. And then finally we come to posture. So we talk a lot about posture, and people are always saying, oh, you need good posture. Posture is not something that you can sort of teach, as in if someone said to you, oh, come on, stand up straight, you know, put your shoulders back, and, you know, what's the problem? You can't really teach posture like that because it's not permanent. That you would, and anyway, it would just be so tiring. You'd probably do it for a minute and go, I can't do that anymore because it really hurts. So posture is something that will emerge through all of the pre-work that you've done, and all of a sudden you start to notice, hey, I feel much better because I'm standing better or I'm sitting better. Your whole mind and body are involved in that posture. You have a healthy alignment, so your joints are no longer out of alignment, which obviously puts them at less risk of injury. And when you're in a healthy alignment, there's less pressure, less strain on that fascia, on that muscle. So the whole body is going to be a lot happier. It's full body integration. And there's a word here, biotensegrity. So this is a fairly new word, but I interpret it as a relationship between the organ, all our internal organs, and the body, all the muscular system, working as a whole. So it's total integrity for the whole body with good tension. So there is tension in the body. If you didn't have tension in your body, you would fall over, or you would look like a sack of potatoes. You wouldn't have support. So we need good tension, but I want good tension as opposed to bad tension. So the bad tension is the one where I'm holding myself, I've got stress in my body, I'm not breathing efficiently, I'm just holding everything together, hoping that nothing goes wrong when I try and move. That alone is going to cause, you know, unhelpful tension in the body. But we do want to promote good tension, the sort that can help you be resilient, can help you stand up, to move, to do your exercise, or just daily activities. We need that. And once you've got this, it's a forever, because it's not that I've taught you a lesson. It's not like you've come and learned how to do a certain exercise and then you go home and you forget that exercise. Because we've talked to your sensory nervous system, we've involved your mind and your body, it's a forever, because you've made a change to your movement patterns. And these are lasting. It's like if you think of, I don't know, a computer disk. Yeah, so you could have a computer that wasn't working very well, but you can erase the computer disk and you can reprogram it with more efficient way of working. And basically that's what we're trying to do. We're trying to take out the faulty movement patterns and the fear and the emotional stress that goes with being fearful of movement. And we want to replace it with calm, resilience, internal belief that will give you this good tension. So that's kind of where the posture comes from. And it just kind of happens. So you'll be amazed at how people can change without, you know, thinking about learning something. It just kind of evolves. So it's a really, really lovely process. Okay. So very briefly, obviously, I think I could have written pages and pages on the benefits for the EDS community. So, you know, very quickly, as I say at the top, the use of language and feelings are key. So how we talk to ourselves during exercise, what feelings we're promoting, those are going to be key. Allowing the body to relax into movement, but from a strong place. So strength and control, improved muscle tone, obviously injury prevention is going to be essential to us. Dynamic posture with stamina. So I need a posture that's going to help me stand up and move about and not get so tired during the day. So it's a moving posture. It's not a fixed posture. Overall quality of life, confidence, all of these things start to emerge from having a different way of looking at movement. And as I said, again, we said this earlier, this is an adaptable base for so many other things. It's not just about doing an exercise, but taking this knowledge, these feelings, and applying them to your life, because we've all got different lives and we all want to do different things. But can I take this information and use it for myself? And that's really where it's come from. And this is just a photograph here of a mat class. Again, you know, looking at that, you might be thinking, gosh, I could never do that because I could never hold my head up and my neck would hurt. But when you have the good tension in your body, so this is a whole body exercise, you would be amazed at how you would be able to do that, because you're not trying to hold yourself up with your neck, but you're using your whole body to take part in that exercise. So there's no such thing as abdominal exercises or leg exercises or neck exercises, because the whole body has to take part in everything you do, which is why I had such an issue with being told to suck in my pelvic floor and suck in my abdominal muscles, because I was thinking, well, I don't do that every day. I don't do that when I get out of bed, and I don't do that when I go to the supermarket, and yet I'm being told to suck in my pelvic floor and hold it and try and move, and that just doesn't seem to make sense to me. So again, I want to get people to move in a natural way. Doesn't mean they're not getting stronger and fitter, of course they are, but they're not putting those bracing patterns into the body. So those are just some of the benefits, and as I say, I think there are many, many more. So further information, as I said, please always check with your medical practitioner first if you're thinking of doing any kind of exercise. I do have Facebook, Twitter, Instagram accounts, and I try and put lots of information and support out there on a daily basis, and I love to interact with you guys as well, so I always reply to any comments. The method, as I say, there's my book, Pilates Without Tears, which is really about this no strain, no pain, no strain attitude to movement. And as I say earlier, I've been writing some blogs for the EDS Society, and I've appeared at some of their events. So, and I'm really excited that I've had lots of requests about, you know, can I recommend therapists around the UK and in the States, and I haven't been able to, but I'm really excited that I am going to be running my first teacher training later this year. So hopefully we'll have more therapists out there who can work in this method as well. And this is just a final photo of Mr. Pilates. Again, not all exercises are going to be suitable or necessary for us to do. I mean, this requires obviously a great deal of shoulders and neck stability and lumbar stability. So, you know, would that necessarily be something you'd want to do? It depends. It depends on your function, but it wouldn't be an exercise I'd be rushing off to teach someone, to be honest. Quite a challenging exercise. Okay, so I think if you have any questions, I would love to take them and help with any questions or queries. You can also email me if you'd rather send me a private question, Jeannie Di Bon. And thank you for listening, and thank you to the EDS Society for hosting me as well today. I really enjoyed being here. And as I say, if there's any questions, I'd love to hear them. Thank you.
Thank you, Jeannie. I'm going to be reading off the questions if you guys want to type them into the question box. I see I'm already getting several, but go ahead and get your questions in, and I'll see how many we can answer. First question we have here. I have POTS along with EDS and have a severe hearing loss with vestibular issues that are exacerbated by using my core. Can Pilates be adjusted to accommodate these obstacles?
So you say did she say they're exacerbated by using the core? Is that what yeah. So again, I've just put my camera on so I can see it. Hopefully you can see me. So again, it really comes down to that approach. So POTS, Pilates movement is fantastic for POTS. Foot exercises, getting those leg muscles stronger are beneficial for POTS. But it depends how you've been using those, that what you call your core. So if there's been bracing and sucking in and holding patterns, then yes, that can maybe cause a few issues. So I think it's really looking at the approach to how you've been doing the exercises would be key. But with regards to, you know, POTS, it is beneficial. So getting the legs moving, getting that stability is really essential to get those calf pumps working, to pump the blood back up the body.
Great, thank you. When I try to exercise my upper back, no matter what exercise I do, I get muscle spasms and my ribs hurt all night. What's the best course of action? Okay,
so it depends. Again, it depends what you would consider upper back exercises. So are you using weights? Are you doing push-ups? It really depends on the exercise. Muscle spasms are because, again, come back to that fascia, everything is contracting because it feels fearful and it feels threatened and it doesn't feel stable. So maybe what I would do with someone who came to see me with that is I would say, okay, let's step back. Let's do some very gentle mobilization, relaxation of those upper back muscles before trying to load them and increase the weights and do whatever it was I was doing. So just take a little step back, take some time to just do some of those gentle rolling patterns that we were talking about, get the fascia moving, get it hydrated, and then it's going to be less likely to spasm. But just think about, okay, what are you actually doing at the moment? Because it may be you just need to back off a little bit.
Would reading your book be the best way to follow your method? What should I do to give it a try?
Okay, yeah, so the book, it lays out step by step the method. And it does have some exercises, which we cut, probably some of them were in the presentation. So that will give you, it's a really easy read and it will give you a good introduction to the method. I do have some videos on YouTube as well. Again, obviously, if they're suitable for you, there's some for pain management and they're all in my method. There's one for stress as well on there. So, I mean, the book is a good place to start if you want to just have some background to the method. And then there are obviously online resources as well on my website, jeanniedibon.com. But the book is a great place to start.
Thank you. How does someone with joint replacement perform these exercises, particularly hip joint replacement, especially if you can't go on the floor or the mat?
Yeah. So yes, so I have a number of people with hip joint replacements. So I don't know where you're doing your exercises, whether you're doing them at home on your own or you're going to a studio. So obviously getting down on the floor can be a challenge. So if you go to a studio, they're going to have the equipment, the tables that you can get on rather than having that challenge of getting down onto the floor. So think of a way that you could adapt that so you don't have to get down. A lot of the exercises can be adapted, so you can do them seated as well. And obviously standing exercises are going to be great for your hip joint stability as well. And if you can get to a studio, reformers are brilliant for any kind of hip joint replacement. So they're very strengthening. But yeah, it really depends how you're doing that. If you're at home, obviously, it's a little bit more challenging and we'd have to think of ways to do those seated.
How long does it usually take to start seeing improvement? And is mat Pilates as effective as the reform?
As the reformer. Well, the reformer is part of the Pilates studio equipment. So if you mean a mat, if we're talking it's more beneficial reformer or mat, both are fantastic, but the benefit of the reformer is that it's going to give you support and feedback for your body, so it improves your proprioception quicker, as opposed to the mat where you're kind of on your own. So if you're lacking proprioception already, you really need some hands-on tactile cueing to help you get that feedback. And in terms of how long, again, everyone is so different and so unique. And I wouldn't want to rush anyone either. So this idea of like me with my yoga, trying to do more to make myself get rid of the pain and feel better, and actually that can be quite detrimental. So I see it as a journey. Enjoy the journey. Don't have expectations. I need to be in a month, I need to be pain free, because we have up days and down days. So you know, a little bit of patience and a little bit of self-care, yeah, just enjoy the journey. But some people can feel things much quicker than others, and it doesn't really matter, because, you know, we all get there. We'll get there in the end.
How do you feel about stretching? It seems there's so much conflicting advice at this point, and I'd love your take on it.
Okay, so stretching, I know that we get very tight muscles and we do like to stretch. I don't do, me personally, I don't do static stretching. So I don't go into a stretch where I hold it till the end of range and I stay there, because a lot of research has shown that there's not really a lot of benefit to static stretching. So the muscle, if you're forcing a muscle to stretch and it's not happy to stretch, the minute you stop, is a bit like, you know, you stretch it, and the minute you stop, it will just ping back to where it was before, because it wasn't happy to do that in the first place. It wasn't ready to do that in the first place. So I'm a bigger fan of what I call dynamic stretching. So we move in and out of a gentle stretch, so that you kind of tease the fascia, you tease the tissue, so that it starts to do a little bit more, and you're much more in control of it rather than holding and just forcing that muscle. So dynamic stretching I do with my clients, obviously within range, not going end of range. And it's really beneficial because you're hydrating the tissue and you're moving at the same time. So that's my take on stretching.
Thank you. I think it looks like we have time for maybe a couple more questions.
Oh, great, thank you.
I love Pilates. However, the Pilates class I took had too much pivoting on my tailbone. It was great for abs, but not so much for my bony tailbone. My skin was actually ripping where I did too much exercise at that pivot position. Any suggestions?
Yeah, so yes, all those teasers and things like that, rollbacks can be a little bit, on a bony coccyx, can be a little bit painful. So again, it depends on the approach. So sometimes we use cushions. If you really want to do those exercises and you feel that's part of your whole experience, nothing wrong with putting a cushion under your coccyx. I do that all the time. If my body needs a little bit of support, then I'm going to give it support. It doesn't mean you're doing the exercise wrong or you can't do it. Sometimes we just need to adapt, and a little bit of cushioning, as long as it's safe and you're not sort of balancing on something, is absolutely fine. You know, I use lots of soft cushions, of balls, to help soften that tissue. So the reason, a lot of the time, the reason that tail is so painful is because the connective tissue is tense around the pelvis, and it's being pulled so tightly in that region. So if you can start to find other ways to mobilize your pelvis, to free up a little bit around there, you shouldn't have quite as much pulling on the tissue, which is why you can feel the bone so much. So try some gentle sort of mobilization exercises as well, to give yourself a little bit more laxity around the tailbone. And then also I recommend using a cushion. Absolutely fine.
Thank you, Jeannie. I think it's about time to wrap up then.
Great.
Thank you so much. I have a list of these questions, and I can get them to
Thank you.
And you can also just remember that you can email her at the email that you see on the screen for any follow-up questions as well.
Yes.
Also, this webinar was recorded, and it will be available on our website and YouTube page within the next few days. Thank you, Jeannie, so much. I will tell you that a lot of these comments were thank yous, and this is a great webinar. So there was a lot of great feedback, and I think that went really well. Thank you so much.
Well, I'm happy. Thank you so much for those comments. Thank you.
Our next webinar will be on Wednesday, April 25th at 10 a.m. Eastern. The topic is, what does the 27 criteria mean for patients? How do we get here? And where are we going? With Lara Bloom. Please watch our social media for signups for that webinar. Thank you all for coming and have a great day.